All right, I believe we are live.
Great.
Good afternoon again. This is American Surgery Center and CHRIAS Bariatric Program. My name is Kemal Erkan. I'm the chairman of American Surgery Center, and I have Dr. Isaias Irgau with me. Our weekly Bariatric Friday session, we are going to go ahead and do this today together. And we started a little bit later, as many of you should know by now that both actually, Dr. Erkan and I, we do have full-time jobs, which is not part of the YouTube, not a YouTuber, but we do, I have a practice to run, and Dr. Erkan is a full-time bariatric and general surgeon, and he was a little bit late with one of the emergency cases that we did. And here we are with you now together. And Dr. Erkan, how are you doing?
Good, Kemal. It's good to be here on Bariatric Friday. Hello, everybody. Again, I'm Dr. Irgau. I'm the president of CHRIAS, Christiana Institute of Advanced Surgery. My specialty is bariatric surgery, and I've been performing bariatric surgery now for 20 years. And with my associates at CHRIAS, we are by far the most experienced group when it comes to bariatric surgery in our area. It's good to be here, Kemal.
All right, thank you, Dr. Erkan. And that message that you just got is from the distribution group, so it's me. Sorry, because people can also hear it, but it was me. Well, thank you for the introduction, and I'm going to go ahead and open the session. Every week we are discussing different topics, and today we have another topic that we are going to discuss. Obviously, our goal is we have our structural webinars. So every second and fourth Tuesday of the month, we do those from the program, and anyone who wants to watch the entire thing can actually participate in one of those. But the goal for this one is more like for us to be able to discuss the bariatric in smaller topics, so that if anyone who's going through the process, you're going to be spending 3 to 6 months before the surgery, and you can watch the entire 2-hour maybe webinar, but this would help you to kind of understand different parts of the process. So while you are waiting for someone, you can actually just turn your YouTube on, because it's going to be available. The video will be available right after we are live. And I am going to go ahead and introduce our other surgeons in the program and other providers in the program. Let's start. So Dr. Irgau as our president, Dr. Gail Wynn. Dr. Wynn is one of the most experienced female bariatric surgeon probably in the world. I should be able to say that comfortably. So Dr. Mike Peters, Dr. Rahul Singh, and Dr. George Ibrahim from the bariatric side. We have 5 bariatric surgeons, as well as we have a colorectal surgeon who's part of the team, Dr. Sachin Naib, and we also are dietitians. Actually, pretty soon we have a 4th person joining this mix. Hopefully, I believe in the mid-November's time it should be. But right now, Fran, Amy, and Beth, who are supporting our patients from the nutrition side of the program. And as Dr. Irgau mentioned, we have done so many surgeries under CHRIAS. My relationship with CHRIAS goes all the way back to 2003. So that's about 18 years. But bariatric did start before that time. And this is the time where bariatric was almost like no option for many people. And today we have given hope for so many people who were struggling in their lives. And I'm actually extremely proud to be part of a program that can give options to the patients who are struggling with this chronic problem. And part of the bariatric, as many people know, it's not just the illness part of it, but it's also part of the social issues that comes with it, and making other people understand what you are dealing with. For example, I do mention every once in a while when my mom knows about what we do with the bariatric, she thinks that we do surgery on everyone, like everyone can get a bariatric surgery. And I keep telling her that that's not what we do. We don't just cut stomachs. So we are actually doing this for people with the right qualifications. And this is not your typical group where they can easily lose weight with with diet and other stuff. Is it impossible? Absolutely not. It is possible, but it is very rare. And our goal is to expedite these people's effort to actually live their life in a more meaningful and healthier way. So speaking of the qualifications, and Dr. Irgau, what are those qualifications for patients to be part of the program?
So essentially, bariatric surgery is indicated as a treatment for morbid obesity when the weight of the person exceeds a certain level. And currently, we say a person has to be about 100 pounds over their ideal body weight. So if their ideal body weight was supposed to be 150 pounds, but now they are 250, 260, then they would qualify based on that. Another way for assessing this is to talk about body mass index or BMI. BMI is a number that is calculated by putting the height and the weight of the person. And there are different categories of BMI, right? So there is a normal BMI where we say 18 to 25 is a normal body mass index. If a person is between 25 and 30, we say that that person is overweight. If the person has a body mass index between 30 and 35, then we talk about class 1 obesity. If it's between 35 and 40, we talk about class 2 obesity, and then over 40, we talk about morbid obesity, essentially. So bariatric surgery right now is indicated for people who have a body mass index greater than 40. Having said that, there are some exceptions. Sometimes even a body mass index as low as 35 can qualify a person for bariatric surgery if that person has actually already developed some very significant illnesses related to obesity, such as type 2 diabetes, high blood pressure, or sleep apnea.
And in those cases, we already work with a group of specialists with our multi-specialty, multidisciplinary approach. But if the patient has A1C with the diabetes, we do have endocrinologist part of the program. And with the other issues, the sleep and cardiovascular issues, we always have the specific specialty as part of the clearance process. Now, Dr. Irgau, we, as I mentioned earlier, well, now actually, in case my mom is watching, so that she knows that I won't get a bariatric surgery. So my stomach is fine for a while, right? So, no, it is really like, even the reason I'm actually mentioning that is because, even when we think that people understand what it is that we do, now, obviously, we do have, from their point, we do have we have a horse in the race. We have a conflict of interest. Why? Because we own a surgery center, you are a surgeon. So, well, in their mind, the idea is, oh, you just want to do surgery. Well, yes, but with the right people. That's the separation. Many people don't understand what our patients are going through. Actually, what patients, people with morbid obesity are going through, and they are still being blamed for the issue that the chronic illness that they have. Have you heard anyone, being blamed for having diabetes or having COPD or having heart problems? But then, if the person have morbid obesity, there are many of the part of the society is putting the public shame to the people. So this is what we deal with, and trying to reach out to these patients to make this right is important. But I think one of the most important part that I see, like we go through like different segments of the surgery process, but I think one of the studies, Dr. Irgau, we discussed this before, but every time we actually bring these up, there are different things comes up, and I was hoping that we would actually have one of those discussions. Now, besides everything that bariatric surgery is doing for our patients, all the other help, what we also know is bariatric surgery extends people's lives. So now I do want to go back to this study with you, and if you can just maybe explain what the study was. This is from the Lancet group, and then also this expected life term, how that's changing, and what are the studies actually really telling us?
Absolutely. So essentially, this is one of many studies that we now have, Kemal, that have shown conclusively that bariatric surgery definitely extends life, right? Now, physicians have known for a very long period of time that there is a relationship between shortened life expectancy and body mass index. In other words, the higher the body mass index is, the less likely it is a person will reach their expected life expectancy, right? So we knew, so there was a relationship between high levels of obesity and shorter life expectancy. We knew that. The question, obviously, we needed to answer as bariatric surgeons is, what does this intervention do to that? If we do bariatric surgery and reduce that body mass index, does that translate in extension of the life expectancy? And, you know, we are surgeons and we are scientists. So we have to really do studies to be able to demonstrate that. And, you know, studies have been done just like this one, where they have followed for many years patients who have high body mass indices. And some of them did have surgery, bariatric surgery, and lost significant amount of weight. Others did not. They did the usual diets, the usual non-surgical treatments that very often are not very effective at treating morbid obesity. And when they looked in the long term, there was a clear difference in mortality, meaning that the patients who were morbidly obese underwent bariatric surgery, they actually lived longer compared to those who never had bariatric surgery and stayed morbidly obese. The ones who stayed morbidly obese, the mortality rate was higher in them. This was demonstrated in this study, but other studies have also shown that. So demonstrating definitely that bariatric surgery does extend life. Now, this is an important thing for us to talk about, Kemal, because it is also at the foremost in the minds of people who are looking for bariatric surgery, right? They are coming to us and they're saying to us, well, this is dangerous surgery. I might die having this surgery. So what really is the advantage for me, right? Yeah. Well, you know, as human beings, we are really wired to look at short-term dangers, and we are much less likely to look at long-term dangers, right? So when we think surgery, the first thing that comes to our mind are potential complications of surgery. But we are much less likely to look at the long-term effects of morbid obesity, right? So we are much more aware of short-term occurrences, but we're not as aware of long-term dangers. So our job is really to explain to our patients that bariatric surgery is not only effective at treating morbid obesity, but it's also a very safe intervention right now, right? Bariatric surgery, in the way we perform it right now, Kemal, is comparable in safety to many procedures that we do commonly, like gallbladder surgery or hip replacement surgery. So it is very, very safe. The margin of safety is extremely high, right? And the advantages are huge. If a person has morbid obesity, they have bariatric surgery, they are more likely to live longer than if they don't have bariatric surgery and they remain morbidly obese. So there is no really proof that is better than this in demonstrating the effectiveness of bariatric surgery. It extends life, it reduces mortality. This is very, very important.
So, Dr. Irgau, this is another study. I think it's part of a different study that actually focuses on people over 65, who are actually what life expectancy actually happens for those people with or without bariatric. Mm-hmm. So now I think what's maybe really clear for people is that so bariatric or morbid obesity is not by itself. It's not just something that you just have morbid obesity. You have other illnesses, which we actually discussed those between the BMI 35 and 39. But in fact, patients with over BMI 40 are going through these other illnesses at the same time. So in many cases, morbid obesity is the origin of the other problems that they have, right?
Absolutely, so, absolutely.
Yeah. It makes a lot of sense to see that this would be, showing an impact on the life expectancy. But I think the studies when there are different researchers, they're actually putting this in a black and white format, then it makes it a lot better to understand. Now, one thing that I want to kind of go through, one diagram that I want to go through with you is the options that people have. Now, what we really need to understand is there are options. So what I was like sometimes earlier, I was just joking, talking about my mom, thinking about it, like that's not 100% accurate. Like she doesn't do that anymore after I explained to her. But options for these patients to reach to this life expectancy, right? So why life expectancy is important. No one is planning to die tomorrow. And it doesn't matter what the age is. And I know this from different people, different group of people, and everyone wants to live longer. Not only they want to live longer, we also want our loved ones to live longer. I mean, no one is ready to lose their parents earlier than whatever that time is. So now, because of the big impact of what this does, what this surgery does, I think understanding what the options are, and then I thought this diagram was kind of helpful from that point, just to show, well, the efficacy of the weight loss, and like even if it's possible in some cases, it is not necessarily staying effective. So then the highest long-term efficacy is with the bariatric surgery. So this was from another study that was explaining it, and I did borrow this image, but it's for the good of the patient, so it should be okay. Now, when you go through the weight loss medications, low-calorie diets or lifestyle changes, the efficacy, because the BMI group that we are discussing is much higher, the efficacy is actually lower with these cases. And they are also maybe lower risk in terms of the intervention that we are doing. Like if you are doing a low-calorie diet, the risk is, other than maybe malnutrition, there may not be a lot of risk there, right? But if you are taking medication, that's still less riskier than surgery. But to see the higher long-term efficacy, the surgery is the only option for the group of people who are dealing with morbid obesity. Did you want to add anything to this, Dr. Irgau?
Sure, absolutely. So essentially, it is part of the what I was saying earlier on, and that is when you look at morbid obesity, you are looking at long-term dangers, right? Because as you correctly said, morbid obesity is not just the weight, it's the illnesses that are associated with it. So morbid obesity is a metabolic illness, right? Our body becomes almost like a factory of illnesses when we are morbidly obese, whether it's cardiovascular illnesses related to high blood pressure, related to heart disease, whether it's metabolic illnesses like type 2 diabetes, or even cancers. We have demonstrated now that many types of cancer are actually much more likely to occur in the presence of morbid obesity or not. So all those are burdens that are likely to shorten the person's life expectancy. So these are, they are years in the making. They are going to happen as the person ages and ages, right? Now, when you look at bariatric surgery, on the other hand, those dangers will go away once bariatric surgery leads to effective weight loss, right? But bariatric surgery itself is surgery. There's no question. There is potential for complications, right? So when you compare bariatric surgery with just doing a diet, of course, there is higher risk with bariatric surgery. There's no question about it. But what we are trying to present here is very important, is that the risk-benefit ratio of bariatric surgery is heavily in favor of the benefit rather than the risk. Why? Because bariatric surgery, first of all, has become very safe in the way we are practicing, right? Doctors have gotten together. They have established criteria that define excellence in bariatric surgery, right? And those criteria have led to establishment of programs that excel in the quality of bariatric surgery provision. And we are part of that, right? We are, our center is accredited by the MBS AQIP, by Blue Cross Blue Shield, by Aetna as a center of excellence. And why is that? Because we undertake bariatric surgery in a safe manner and we have excellent outcomes with it. So we are providing relatively high risk surgery with the lowest risk, right? Because of the quality of the bariatric surgery. But the benefits of bariatric surgery are enormous because the person then will have a longer life expectancy, better quality of life, and they will not be ravaged by the illnesses associated with morbid obesity. So yes, you can do low risk interventions for morbid obesity, but the effectiveness is not there. Most people who try diets, they try them year after year after year after year because they don't work. And the problem, obviously, as you and I know very well, Kemal, is that morbid obesity, as you are not able to defeat it with diets or other less effective methods, it doesn't remain there. It's not that the person is at a body mass index of 40 now and they will stay there. No, the morbid obesity invites more weight. It's a platform for gaining even more weight. It becomes a lot easier to gain even more weight once you reach that level. So if you are morbidly obese today, in 5 years' time, if it's not rated effectively, the weight is more likely to be even higher in 5 years' time. So we're talking about a chronic progressive illness. It is unrelenting in the way it affects people.
And we see that in our returning consults, like when a patient starts the process and then 2 years later, 12 months later, 3 years later, they come back and 97% of the time they have at least 10% more weight than the last time they were with us. So, well, of course, all we can do is to put the education out there and then make sure that everyone is understanding what's available to them. But I think what can say this story better than our patients who are happy with our services, and right now we are 99.4% on patient satisfaction. And this is, like I update this every time we actually present. I was just checking the last presentation, so there was about 143 total surveys. Right now, we are at 99.4% satisfaction level with our patients. So this actually just by itself tells a lot. Now, speaking of what's available for a patient, one other thing that I discussed this before, for our patients who have who may be on Medicaid programs such as Health Options or MeraHealth Caritas, there is a medical transportation available for them because in many cases, patients are having issues with their appointments or delaying the procedure because of their issues with transportation, but there is a medical transportation option available through these insurances. Now, Medicaid is providing this is pretty significant. So, and this is available, and you can actually directly reach out to the from Medicaid of Delaware site to see what's available to you. And then also, of course, we are keeping these events on a weekly basis with our other events, such as our webinars and support groups. Bariatric Friday, honestly, every Friday, 3 p.m. And CHRIAS free weight loss webinar is the second and fourth Tuesday, 6 p.m. And our UMACO recent updates every Friday, 2 p.m. and Wednesday wellness webinar, second and fourth Wednesday at 7 p.m. This last one with the Wednesday wellness webinar, although it's through our diabetes program, but it is also from the same providers who are providing the support for our bariatric group. So, and we do discuss bariatric related topics there as well. But there are so much available out there for our patients, and we want to make sure that we can actually make this a pleasant experience for everyone, and hopefully we can help you and then live longer. Dr. Irgau, anything you would like to add?
Yes, I would, Kemal. So as you correctly said, our job here is really to educate people. And now we firmly know that bariatric surgery is by far the most effective treatment we have for morbid obesity, and that morbid obesity is a deadly disease. There's no question about that. That is very important. But we also know that bariatric surgery is not for everybody. And there are people cannot be prescribed, they cannot be pushed to have bariatric surgery. They have to be themselves comfortable about it. And some people may not be, saying they may not be ready. And many patients, come to me and say, I've been thinking about this for about 2 years, 3 years. At the beginning, I was totally against it. And then over time, the idea matured on my head that really this is my only way to get help, right? So people who are not ready, they are not ready. Does it mean they should not try other methods? Absolutely not. They should continue to do everything they can to reduce the risk of weight gain, whether it's watching what they eat, whether it's being active, or getting other helps from their doctor. So bariatric surgery is the best option. It's the most effective option that we have right now, but it doesn't mean everybody is ready for it. And also when people come to us, it doesn't mean everybody gets operated on. We have a very extensive evaluation and education process, and some people may not be eligible because they may not show adequate commitment that they want to also make changes. And that commitment to want to change is actually an important requirement for somebody to become a bariatric patient and succeed as a bariatric patient.
Absolutely. And the benefits are so many, they're there in so many different ways. And doing this in the right time with the right people is the most probably important element of the process. And we are here for those who are looking for help, and reach out to us. And from any different way, you can have appointments, you can actually email us, you can reach out to us on social media, but we are available, we are accessible, and we'll be back next Friday at 3 p.m. Dr. Irgau, thank you so much for joining me.
Thank you, everybody. Have a good weekend.
Have a nice